The first part of this video is going to discuss what will be expected of you when you're managing some of the scenarios in today's study. So the first thing to remember is to think out loud. There's somebody that's going to be evaluating your performance so that they can give you feedback on how to improve. In order for them to be able to give you sufficient feedback, they need to know what you're thinking so they can help see what you're doing. So therefore, verbalize as much as you can. For example, in verbalizing what you are thinking, after you do a little bit of an assessment, one thing to verbalize could be, he seems to be inclined to rest. Also verbalize what you actually feel, see, and hear. For example, he's unresponsive. The pulse is strong and regular. He's not breathing.
1, 2, 3, 4.
Verbalize what you're doing. I'm checking the pulse for 10 seconds. I'm doing 30 compressions, 2 inches deep at 100 per minute. I'm removing the face mask. Lastly, verbalize what you want your assistant to do. Can you stabilize C-spine? Come over here and let's roll the victim. Pull the helmet off. Pull the shoulder pads off. Again, it's important to verbalize all these things so that the examiner knows exactly what you're saying, what you're thinking, and what you're doing. Also, remember to speak loud and clear so that the examiner has no question with respect to what you're thinking, what you're doing, and what you're saying. Do what you say you will do. So if you're going to say that you're going to check the pulse, actually check the pulse. Also, treat your patient like a patient. Actually talk to the patient, try to assess the patient, and then manage everything on the patient in front of you. There will be some situations where you're going to have to ask your assistant to do certain things, but they will give you a response. So if you tell them to do something, and they can do it as per the scenario, then they'll just say, I know how to do that, and you do not have to teach them how. There's other things you might ask them to do that they are not allowed to do, only because we want to see you do it. And so their response to that will be, I cannot do that. In situations where you have to call EMS or get AED or anything along those lines, here are some other things that you might hear your assistant say during the scenario. EMS is called and will be here in 10 minutes. Somebody is getting the AED. EMS has been updated, and no EMS update available. So here's what the assistant can and cannot do. If you ask the student or the assistant to do stabilizing C-spine, removing the helmet or shoulder pads, or stabilizing the torso on the log roll, they'll simply say, I know how to do that, and they'll just go ahead and do it. Now, if you ask your assistant to do chest compressions, ventilations, rescue breathing, airway opening maneuvers, AED applications, or C-spine on a log roll, or face mask detachment, they're simply going to say, I cannot do that. Now, if for whatever reason the scenario needs to be stopped, so if the scenario ends, or if you feel uncomfortable, if the examiner has a technical issue, the scenario can stop. The emergency stoppage code is timeout. So when the scenario ends, the assistant will say timeout. If you are feeling uncomfortable and need to stop the scenario for whatever reason, just look at the assistant and call timeout. This clip will demonstrate respiratory arrest. The patient in this particular scenario is going to be prone and not wearing any equipment. Grabbing C-spine. Hey, wake up, wake up, wake up. No response. Hey, you, go call EMS. I have an unconscious adult. And come with an AED. Look, listening, and feeling for breathing. The victim's not breathing. I have to roll the person immediately. I'm looking in the mouth, there's nothing there. Head tilt, chin lift, look, listen, and feel for 10 seconds. the victim is not breathing. I'm going to administer rescue breaths. And my breaths go in, so I administer 2. Inserting an OPA, measuring from the earlobe to the corner of the mouth. Insert it inverted and then rotate it 180 degrees. For this study, you are not using an OPA, oropharyngeal airway. Checking circulation for no longer than 10 seconds. I do feel a pulse. Victim is not breathing, so I'm going to continue with rescue breathing. 1 breath every 5 seconds. And recheck pulse every 2 minutes. After 2 minutes of rescue breathing, I'm going to recheck pulse for 10 seconds. If there is a pulse, check breathing, and if they're not breathing, continue with rescue breathing. This next scenario is going to demonstrate management of a person in respiratory rest who is prone, wearing football equipment, and with face mask detachment tools available. Stabilize C-spine. Assess responsiveness. Hey, wake up, wake up. Wake up, wake up. No response. Hey, you go call EMS. I have an unconscious adult. Please come back as soon as you can. I'm going to look in the airway, clear the airway, and then look, listen, and feel for breathing for 10 seconds. If the victim is not breathing, I'm going to roll right away. Immediately when they're supine, I'm going to check circulation because they have equipment on first. If there is no pulse, I'm going to access the chest right away. I do feel a pulse, so there's no need to access the chest. I'm going to look, listen, and feel for breathing for 10 seconds, and the victim is not breathing. Since there is a pulse and the victim is not breathing, I have to access the airway. Since I have face mask detachment tools available, I will use them to attempt to remove the face mask in less than 30 seconds. If this procedure takes longer than 30 seconds, initiate full equipment removal. Once I have detached the face mask, I will attempt to ventilate with rescue breaths, putting in 2 rescue breaths. It should take 1 to 2 seconds per breath, and I'm looking for chest rise. And since the breaths go in, I'm going to continue with 1 breath every 5 seconds. Here are the key points. First of all, you need to ensure that you can recognize the emergency. In this particular case, the victim did have a pulse but was not breathing. In addition, during the ventilation attempts, the breaths did elicit a chest rise, which means that there was no airway obstruction. Therefore, the person was in respiratory rest. Rescue breathing is 1 breath every 5 to 6 seconds for an adult, while checking circulation every 2 minutes. Again, if airway access is possible because you have face mask detachment tools, then access the airway first to manage the situation. If you cannot remove the face mask in less than 30 seconds, then you need to initiate full helmet and shoulder pad removal in order to access the airway.